What is a Medicare Advantage plan? This is the third part in this series. If you haven't watched the first two parts, what is Medicare 101? What is a Medicare supplement? I advise you do that. They're linked right below in the comments. A Medicare Advantage plan is an insurance contract policy issued by a private insurance company. And they essentially replace original Medicare. You can't have a Medicare Advantage plan and original Medicare because these insurance companies have contracts with Medicare, with the federal government, and they all must be approved by the federal government, so they are aware of whether you have original Medicare or Medicare Advantage plan. Let me talk about the birth of the Advantage plan. Really, this happened in most markets about 20 years ago, but it started to happen almost 30 years ago. The Medicare supplemental plans that work with original Medicare, they started to get expensive and they were pricing people out. People couldn't really afford to keep them. So these insurance companies, the same insurance companies that issue Medicare supplemental policies, they came up with an alternative. They approached Medicare and they said, let us take over Medicare for anybody who decides to sign on with us. And Medicare said, okay, as long as your plan is as good as, if not better than original Medicare. Medicare Advantage is also known as Part C, and in this video I'm going to show you how you can find one that would be most suitable for you in the fastest possible way. This is going to save you a lot of time. When you have a Medicare Advantage plan, your Part A and Part B of Medicare services are now assigned to an insurance company and subject to their cost sharing, their co-pays, and their cost sharing when you use medical services, which I'm going to go over with you in a minute. Additionally, most of these plans that we recommend have Part D plans included. It's like a buffet of services. I can't stress enough that you can have a Medicare supplement and a drug plan or a Medicare Advantage plan. You cannot have both. The main difference between the two is that with Medicare A and B, there's no network. Any doctor or hospital that takes Medicare, which is 98% of them, will accept Medicare, original Medicare, with a supplement or without a supplement. On the Medicare Advantage side, they contract with networks of doctors and hospitals, which works fine for millions and millions of people. The Medicare Advantage may have an additional premium, some don't. Some have an additional premium, some have a negative premium, depending upon your situation. And usually there's some sort of pre-approval process. If you're going to have outpatient surgery, a cataract, a shoulder replacement, knee replacement, typically the office of the procedure, whoever is performing it, will write to the insurance company to get pre-approval so that everything is known ahead of time. It's usually unnecessary with Medicare because they're very predictable, having been doing this for so many years with them. Advantage plans also may offer extra benefits. Most of them do have a gym membership, not all of them. Some have some dental benefits. Some offer hearing aids. Some offer some vision or eyewear. Some offer acupuncture. You just have to do a little comparison shopping. All of this information and all of these slides come from the Medicare.gov website, so it's easy to find. So here's a typical look at a comparison between two plans that I found on the Medicare website. For our area in New York, we handle a lot of the East Coast. You're looking at what the copay is for a primary doctor visit, for a specialist visit, for the ER. You can see all the services here. Pay attention to things like inpatient care. What is your financial responsibility if you are overnight in the hospital for so many nights, X many nights? This next slide, you can see where your responsibility is for the skilled care, that's inpatient rehabilitation. This is the type of comparison that you'd like to do to find the plan that's right for you. Once again, here we are, Aaron and Travis. We run MedicarePrepare.com. Stay tuned. I'm going to give you a little tip next. If you get something in the mail and it comes from an insurance company on a Medicare Advantage plan that looks really attractive and you like this benefit, you like this benefit, I say don't waste your time looking through it. The first thing you want to do when you're looking for a Medicare Advantage plan is to make sure you're only looking at plans that cover the doctors that you want to use and the medications that you take with the pharmacy that you like. You can waste a lot of time trying to find the great benefits, and then you find out your doctor doesn't take it. Finding the right Medicare Advantage plan for you is about a process of elimination. I'm going to eliminate these plans because they don't cover the doctors that I want, and they don't cover the medications that I want. Then you can look at what's remaining, and that makes it a lot easier. You don't have to use somebody like us, but it'll save you an awful lot of time. This is something that AI cannot replace, the human touch that we offer because of our familiarity and our ability to look up networks, doctors, medications like that for you.